Good afternoon all. Welcome you all to yet another live session. Today we are back with another interesting topic in which we are best at robotic assisted surgery and its advantages, the early detection signs that you would need to recognize. Joining us today on our live session, we have Dr. Prashanth R, a robotic surgeon, founder, director, Specialist Hospital Bangalore. Welcome, doctor, to our session.
Good afternoon, everyone.
We will start off with a simple explanation to our viewers on what is knee pain and how do we get it.
Okay. Good afternoon, everyone who's watching live today. So now knee pain is everyone after 45, 50, everyone develops knee pain. And that's become so common these days that everyone experiences knee pain, at least I would say in a year, once or twice, maybe after 45 or something. So knee pains are becoming more and more, and most common cause for knee pain is osteoarthritis of the knee, where the cartilage of the normal knee joint gets damaged and which causes pain and which leads to degeneration of the joints, which leads to a lot of pain, not able to walk. So and I would blame it on no exercise, obesity, and and lifestyle modifications especially. So that's the most common cause for actually knee pain. So today we're going to talk about osteoarthritis of the knees.
Thank you, doctor. You had mentioned osteoarthritis. What is arthritis and what are the types of arthritis?
So arthritis, in a common sense, common language, what we call is degeneration of the knee joints. So degeneration can happen with age. Degeneration can happen with joint inflammation disease called rheumatoid arthritis. Degeneration can happen when you have had an injury to the knee joint, where the knee joint is damaged. Then over the years the degeneration can happen. So these are the different kinds of degeneration, arthritis what we call, of the knees. And the age related arthritis, we call it osteoarthritis, and that's the most common in what we see in day-to-day life, and which is very common these days.
Arthritis becoming common these days. What are the risk factors leading to arthritis?
As I told you, risk factors are basically is mostly lifestyle dependent. Obesity is one major thing. No exercises at all, and the muscle strength being very weak. I would say these are the most important risk factors. And we Indians squatting on the floor, taking stairs too much. Like I always advise everyone to walk, climb up stairs. But if your muscles are weak and you're not used to climbing upstairs, that means there is a lot of strain on your knee. And when you do it regularly, what happens? The knee slowly gets degenerated. I would say that you need to exercise to be fit, and exercise is very important, and lack of exercise is one of the major problems with what we're facing these days, which lead to arthritis. Yes, there are instances where arthritis can happen at a very early age. That can be hereditary, and we call it primary osteoarthritis, where the cause is not known. Where joints can get degenerated all of a sudden. So that's one of the very few cases what we see. But most of the cases in my daily practice, what we say is because of lack of exercises and obesity, muscle tone is very less, and unhealthy lifestyle habits. That's what I would put it as.
What are the symptoms, causes, and risk factors of knee pain?
So the most common symptom with knee pain is pain. Everyone comes with pain. And next is stiffness of the knee joint and inability to walk too much. And another most common symptom is they have this creaking noise, what we call crepitus, and they'll have difficulty in walking. These are the symptoms. But I would say pain is one of the most common symptom and most important symptom, which leads where the patient is very, it's very disturbing to the patient, and patient becomes very apprehensive because of pain. And these are the most common symptoms. And as I told you, risk factors for knee pain is as I told you previously, is the lifestyle and obesity, lack of exercise. That's what I would put it as.
Once a person gets knee pain, what will be the diagnosis and treatment, and how do we prevent this to occur in the future?
So the first thing is you've got to consult your doctor, and for us the most important investigations is an X-ray. X-ray will tell you how much degeneration, how early is your arthritis stage. There are 4 stages of arthritis, where stage 1 is very minimal and stage 4 is where the knee joint is totally destroyed. So and that is one. First thing is you need to diagnose. First thing, once you diagnose it, and depends on the stage of the disease where we treat patients actually. So it can be once, if it's stage 1, then exercise, little bit of painkillers, lifestyle modifications like no climbing upstairs, no sitting on the floor, and for some time, not always. I believe that joint flexibility is very important for each and every individual. And if you lose out on flexibility, the arthritis actually becomes more. So I always advise patients to do at the initial phase when there is a lot of pain, I tell them not to sit on the floor or climb upstairs too much. But once the pain settles down, yes, I want them to get back to the routine. So that's in stage 1, where we treat them with some joint supplements like chondroitin sulfate or collagen peptides. Or if it's in stage 2, we put in an injection we call hyaluronic acid. It's a synovial fluid, which is grown in the lab, and we inject it in the knee joint. So, and depends on the stage. In stage 4, we all know it's knee replacement, and sometimes in stage 2 and 3, we might do a small keyhole procedure where we wash the joint. We call this arthroscopy, synovectomy, arthroscopic debridement, what we call. And these are the few modalities where we do, depending on the stage of the disease. Not everyone requires surgery, I would say. Most of them who come, if they come early to the doctor, if they get treated early, I believe that we can save that knee. We can always at least postpone the need of surgery. So it's always, I believe that God-given knee is always the best, rather than what we surgeons put in. So the best thing for us is to save your native knee. So that is what, and for that you need to do exercise, reduce weight, and consult your doctor, take medications, do physiotherapy, that is exercises. All this is very important.
When is the right time to see the doctor once a person has knee pain?
I would say if everyone goes through knee pain, the best time to see a doctor if the pain is not settling down, or day by day the pain is increasing, or where the patient, where you're not able to do your routines, like what you used to walk for 1 kilometer, now you can't walk. And morning there's a lot of stiffness, there's a lot of swelling in your knee joint where your knee is not feeling right. I think it's best thing is to not to delay it. At least consult a doctor. Let's see what's happening, and you get an investigation done. If X-ray is normal, get an MRI done to see if there's any cartilage damage or what we call the meniscus, the ligaments damage. So I think sooner the better. If your pain symptoms are not settling down, or it is incapacitating you to do your routine work, maybe I would say a week, 10 days, 2 weeks, but not more than that. I think you need to see a doctor before that.
Thank you, Doctor. Now, moving on to the topic of our day and your expertise. What is a robotic assisted surgery and how robotic assisted surgery works?
So, yes. Yes, now coming to the final aspect where I have to intervene, where surgeon has to intervene, we do something called knee replacement, where we shave the bone of the knee joint and we put in a metal prosthesis, so that where the cartilage is gone, we put in a metal cap above and below, and that acts like a knee joint. So it's the most successful procedure in orthopedics, actually, to be frank. So I expertise in robotics. So I started robotics about 2.5 years ago. And why I started robotics? Yes. When you ask 10 patients about knee replacement, I would say that 5 people were very happy with the knee replacement, and the 50% of patients were unhappy. So there were these inconsistent results with normal knee replacement, I would say conventional surgery. What are the causes for it? So causes can be where the surgeon is not able to find out whether he's done a good procedure or not. There's no validation. So we come to know whether this procedure was successful or not only after surgery, after a few months, where patient says I'm happy, but most of the patient says I'm not happy, then I can't go back and redo the procedure. So with all this, where robotics actually kicked in to help the surgeon, so that he does the procedure very well, so that the blood loss is not there. There's so many advantages of it, and it's actually for the betterment of the patient. So these are the why robotic came in. And robotics is, we use an artificial intelligence, where what I do is, once I open the knee joint, I put in the data of the knee, like how much cartilage is lost and how much bone is lost, the alignment of the knee. Everything is done real time inside the operation theater, where I have a like you all play with soft smartphones these days. You have this smart pens. I've got a smart pointer in my operation theater, where I draw over the knee, and the whole 3D image of the knee comes on the system, and of the knee as well as the lower leg, and that gives me a picture of the knee. If I move the knee, the 3D image moves. So depending on the alignment of how much the cartilage is on, the computer gives me which implant to use, how much bone to take, and it'll tell me the result also. So we are in the age of artificial intelligence. So this is an artificial intelligence. It all works with algorithms, and it tells me the result of the procedure. If I use this implant, if I put the implant in this angle, or so much bone I take, so all that is calculated by the computer, and will tell me the result. And if I'm happy with the result, then I go ahead and do my actual procedure. So the comfort is where I have not started the surgery and I know the result. That means before I could do the surgery, before I could do the final stages of surgery, I know what implant to use, what is the thing. So it helps me to be a better surgeon. And if I'm not happy, actually I'm the boss in the operation theater. If I'm not happy, I can always overrule it, make it better, the cuts better, the alignment better, and then I ask the computer, give a command to the computer to cut the bone. So how do we cut the bone? So we have a robotic handle, which I have it in my hand, and I place it over the knee, and it cuts the bone in that particular shape, and so that the implant what we put is aligned properly. So this is how robotics happen, and after the procedure we actually see what we planned and what we got is actually 100% accurate, equal what we planned and thing. And this is not only one procedure, every procedure is 100% thing, it's 100% accurate. So that's how robotics are. So it's got to be precise, it's got to be accurate, and it should be safe to the patient. And so these are three things what I believe that robotics is kicked in orthopedics, and especially in joint replacement, because most of the patients who come to us are old people. And the one question everyone tells that, why knee replacement at this age, doctor? I'm already old, 70 years, 80 years. Why should I get it done? I've lived my life. So they come to me with a lot of expectations. So that they walk better, they lead a normal life until they're alive. So the expectations of them undergoing surgery at that age is more. And as a surgeon, I have to see that I match the expectations. And how can I match the expectations for each and every patient? I think robotics is the answer. So that is where robotics is doing, and that's where all my patients are very happy with robotics surgeries actually.
Thank you, doctor. That was a very elaborate but simple way of explaining a complex procedure that you are an expert at. How is robotic surgery better than conventional surgery, and what are the advantages?
So in conventional surgery, as I told you, we cut the bone, and we just cut the bone. We make some measurements, and we just cut the bone, and what we've seen is actually we usually take more bone when we do it conventionally. And in literature where they've compared robotics with conventional, the blood loss is more. We are dealing with old people where blood loss is more. You know how what systemic implications are there with old people. So in conventional surgery, the blood loss is more than robotic. So I would say is more precise, accurate than conventional surgery. And the most important thing is the pain. With robotics, because we conserve the ligaments, we conserve the bone, the pain aspect is very less. I would say very less. So the recovery is very faster, because we don't touch their native ligaments, and we only take bone out what is required. We don't release the ligaments so much. So these are the advantages with robotic surgery, and they're all up and about walking the same day. Next day they're independent on their own. They go to the toilet, come back, they're independent. That's the most important. Everyone asks me, doctor, when will I start walking? When will I be independent? I don't want anyone to help me around. I said, no, I'm doing surgery for you to walk, so you are independent. So this is the advantage of robotics over conventional. But conventional, where results are inconsistent, there's a lot of pain, stiffness of the knees. But with robotics, I think all that is not there.
During the process of explaining, you had mentioned implants. So what kind of implants is used, and how long are these implants expected to last?
So I use from a company called Smith & Nephew, I use an implant called Journey. That's one of their latest versions of the implant. And why I use that implant is because the design of the implant. So it's supposed to be one of the most recent advanced implant, where it mimics the natural knee. So that is one, and it is made up of something called what we call oxenium. Everyone asks me, doctor, how many years this knee will last? So this material, oxenium, with what the insert, what we call highly cross-linked poly, in the lab is shown to last for about 20-25 years. So because it's one of the most the best implant in the world for longevity, and best implant in the world for to mimic the natural knee. So this is I use this implant, and this is the one which is actually changing game for my patients, where they feel very natural. They don't feel like they've undergone knee replacement. I have few patients who can run with this knee, so that's one thing which I feel very happy and proud of. But I don't advise them to run. But yes, that only shows me that they're so confident on the knee of after the surgery, and I would attribute to it robotics or the design of the implant. So this is the implant what I'm going to use. I use usually.
When a person is admitted for this robotic procedure, how long do they have to stay in the hospital?
So usually with robotics, the recovery is very fast. So I keep the patients who are young, very fit for 48 hours. If the patient is diabetic or any cardiac issues, I might stretch it to 1 day extra. So about 48 to 72 hours, or at the max 1 more day extra, or that will be counted as the day of discharge. So it's max about 3 days, but depends on the patient to patient. If most of our patients have got comorbid conditions, sugars going up, down, so I need to monitor the sugars very well, because for me, my dreaded enemy is infection. So for me, I want, before the patient leaves, I want him to be absolutely fine. The family should be very comfortable to take care of him, or rather he must be comfortable. Patient should be comfortable to go home. So most of my patients are very comfortable at within 48 hours to go home, but I stretch them 1 day plus if they are diabetic or so. But I would say 48 to 72 hours, they're up and about and they're ready to get discharged.
That is very encouraging to know short post-op stay in the hospital. Post-surgery, how many days of physiotherapy would be required?
Actually, post-surgery, the physiotherapy starts on the same day of surgery, where my physiotherapist comes, encourages them to walk until they get the bearings right, they're not wobbly. So first day is a bit of, they're very careful, and from the next day, they're very confident. They walk all the way down the corridor. They're very, very happy, with physio. But I would say, I want my patients to be up and about walking, so physiotherapy is very important. So I want them, it depends on patient to patients. So for some people who are very, very active, who muscle strength is very good, I tell them physio for a week or so. But most of our patients who come late, where muscle power is so less, they need lot of encouragement to do exercise. And at home, if people say anything, they want to exercise, you need an external source for them to motivate, to make them do. I think at least 2 weeks of physiotherapy post surgery. Yes, they need to continue their exercise for few more weeks, but depends on the patient, from 1 week to 10 days to 2 weeks, depends on patient to patient. But I would say about 1 week to 2 weeks.
How about the pain after the procedure?
So that's the game changer with robotics. The pain is, I would say, about 50% less than the conventional surgery. Definitely pain would be there. Any surgery pain would be there. And with robotics, I've seen patients, pain come down drastically, 50% from conventional surgery. I've seen patients who recover so fast that they've gone back to work in 2 weeks. So yes, so it shows that how comfortable they are and how pain-free they are to get back to work. So pain would be there, but when I'm comparing it to conventional surgery, I would say 50% it is less.
And once they are home, how many weeks will it take for a patient or a person to walk and do normal daily activities?
So I always tell my patients that I do the surgery for them to walk. So for them, is their routine activities starts from the next day of the surgery. So they do their routine, they walk, they go to the toilet, come back, they dress them up. So their routine activities are started from day one. But for them to do other activities. Like most of them who undergo knee replacement are women, and they'll ask me one question, doctor, when I can go into the kitchen. So I would say that for them to do activities of the house, I would say 1 month. Definitely, after the procedure, when the muscle strength goes down, you need to do a lot of physiotherapy and things like that. So usually it takes some time for them to get the strength back. So I would say 1 month. That is a good time for them to do other procedures, other household activities actually. Driving, maybe after 1 month. Two-wheeler, I would say by about 6 to 8 weeks. So that's what.
Thank you, Doctor. What would be your final take-home message for our viewers on this topic?
So the final take-home message is, first thing is, don't get into surgeries. The only thing how you can avoid surgery is you need to see a doctor when you have pain. And once you have pain, you have to do lot of lifestyle modifications. Like if you're obese, if your BMI is more, you need to see that you reduce your weight, do yoga, consult your doctor, take medications. And I think you should not come to a point where you should not allow you should not allow the knee to get deteriorated. That must be your first challenge, I would say. Yes, for some, unfortunately, if things go wrong, if things deteriorate, definitely you can always don't get scared. There's always a solution for it to reclaim your life, I would say. So recently I've done a surgery on a singer, and she's running. So that's how patients are. So it's not the end of the road. There is life, there is an option for you to be normal. So don't get worried, but I don't want you all to think about that option or the last option. I want you all to sort your knee out before you get into the clutches of surgeons where you need surgery and things like that. So I would say from the age of 30, 35, take your health seriously, exercise, you need to do it consistently. That is the most thing. Not 1 month of exercise, 6 months of rest. And what people do, they're very active. 1 month they're in that enthusiasm. They actually enjoy the knees more further. I want you all to exercise regularly. Start off with small workouts, gradually increase, strengthen your muscle. I would say that is the most mantra, rather than, definitely I would expect a lot of young people listening to this or seeing me, and I would give that message rather than, don't worry, get the surgery done. No, I don't want you all to get into surgical mode. So I want you all to see that how you're going to save what God given knee. That would be my message, rather than saying that here is a very good surgery, come down, get the surgery done. No, I would not say that. I would say that exercise, be healthy, and be consistent, watch your diet, and especially if you have any comorbidities like thyroid, I want you to first get it checked so that you don't put on weight. So that would be my message. Thank you.
Thank you, sir. That was very inspirational for all our viewers, and also I hope you all had an elaborate explanation and understanding of what robotic surgery was. We'll join you soon next week with another interesting topic. Until then, take care and stay safe. Thank you.